y'all? Shadows and Sounds back here in northern Utah talking about testicular cancer. Hopefully these videos help you in some way. They're helping me. So I left you at the end of the last video talking about pathology. So after you get your surgery, they send your testicle or your mass off to get a biopsy done, and then they find out what it's made of. So the reason this is important is because there's two main types of cancer in your testicles. There's seminoma and non-seminoma. The seminoma cancers are fairly basic to treat. They just require removal of the testicle for the most part, and then some, intermittent CT scans to make sure it doesn't come back. So that's pretty good. And I was told I had a seminoma because I didn't have any tumor markers in my blood. So they'll do blood work first. Be prepared for that. Getting stuck a whole bunch, you turn into a pincushion. So unfortunately though, despite my blood work, I got my pathology back. So this is where the pathology report comes in. So my huge 7-page pathology report stated, and I'll just read my final diagnosis verbatim here. There are 4 points, really only 2 matter. First one is, quote, mixed germ cell tumor, 1.6 centimeters in diameter, greater than 95% embryonal carcinoma, which is a non-seminoma. Less than 5% seminoma, arising within testes associated with intratubular germ cell neoplasia. So, intratubular germ cell neoplasia, that I'm sorry, I can't help you with. Google that. Intratubular germ cell neoplasia. I'll just back up to the first part. So it is an embryonal carcinoma, which means it's a non-seminoma, which means I need chemotherapy. Different than we thought. So it was a curveball. Nothing is ever certain until you get your pathology back. That's what I'll say. So don't hedge your bets or don't plan on anything until you get your report back. Second part reiterates or emphasizes the need for chemotherapy. Says, quote, lymphovascular tumor invasion noted within testes proper, tunica albuginea focally, and periepididymal soft tissues focally. So I imagine those really weird words are 2 locations in my lymph system where the lymph nodes have swollen a little bit. Now, the surgeon I spoke with who called me on the findings did not know, and most surgeons won't know until they're able to watch it, whether the swelling of lymph nodes is due to surgery or it's due to cancerous invasion. So surgeries, I guess, affect lymph nodes. So he made me wait 5 weeks before I went and got another CT scan to see if the lymph node had grown or shrunk. If it had shrunk, it means it was due to surgery. If it grew, it means it was invaded with cancerous cells. So unfortunately, on the 5th of March, I believe the date it was, I got another CT scan, called about the 6th or 7th to get a follow-up, and yeah, it had grown. It grew from he said it was 0.9 centimeters to 1.4, so it grew half a centimeter in 5 weeks. Kind of scary, but yeah, so that's why you get a pathology, that's why you do all of this. So that's what a pathology report is. Also included in this talks about the different stages of cancer. Technically, I'm at stage 2A, which will require a treatment of BEP. It's 3 drugs that I don't think I can pronounce unless they're written down here on a piece of paper. Yeah, so it's going to be, well, I'm not going to make you wait while I locate it, but there are 3 drugs that are really bad they give you. But they don't, your doctor doesn't just decide this. Your doctor issues or recommends treatment based on the guidelines set forth by the National Cancer Institute, so the National Health Organization. So, but that's still just a recommendation. So I'm already almost at 5 minutes, but I'll keep it brief to finish this up. Pathology will give your doctor a place to go to recommend treatment. After pathology, your post-surgery, now you've been told, maybe in my case, you need chemotherapy, you don't know how much. Now I know I need 3 cycles of chemotherapy, which, I'll do the whole next video on chemotherapy and what that means. But after your family doctor, your urologist, maybe your cancer specialist, who's probably also a urologist, now you're probably moving on to another doctor in oncology, which is medical speak for treatment. So oncology is a huge team in almost every hospital. It's a lot of people working to help you get the treatment of whatever kind of treatment you need. Sometimes it's cancer, sometimes it's other stuff, but oncology just means treatment. So don't try to keep all the names straight. You know, there are going to be a lot of nurses and a lot of assistants, a lot of people you work with aside from doctors. Just do the best you can and don't beat yourself up when you don't remember somebody. Last thing I'll leave this video with is, because of this and the necessity of chemotherapy, if you need chemotherapy or you're talking about that, I'd recommend looking at sperm banking. Not for everybody, but in my case, I'm considering it. You know, it's just something you should definitely think about. If you're considering, I would recommend contacting the Live Strong Foundation. That's livestrong.org. That's the Lance Armstrong Foundation. Forget about that. But the Live Strong group is amazing. They have great people who will follow up with you. They don't wait for you to call them. They will follow up with you at a time and you know, phone number if you're choosing. And they will help you find and identify resources to help you with fertility treatment if that's something you need. They also have counselors and a whole host of tools for us victims. So I'll leave it there. 6.5 minutes. Shadows and sounds. Check into my next video, video 4. We're going to talk a little bit about chemotherapy, what this means. Keep in mind, this is all pre-treatment to me. Today's March 21st. I scheduled to start treatment on April 2nd, I believe. My first meeting with my oncologist is next Monday, so that's going to be Monday, March 26th, 2 days before my 32nd birthday. So that'll be fun. Good birthday present, right? Yeah, follow me in my next video. Talk about chemo, and then pretty soon you'll be following me through treatment. So we'll go from there. Shadows and sounds. Peace.